So thank you so much, Mark, for the nice introduction. I'm not only excited to be here today, but I also feel really passionately about sharing some useful insights with you because I really truly believe that I'm your target market. But before I start, I'd like you to make a promise to me that you won't judge me for being a hypochondriac as I share these personal things with you, but also being in a room full of clinicians, I know that you'll treat my personal information that I share with confidence. So, as Mark mentioned, I've worked at Google for 12 years. So, I truly believe that search is probably in my DNA by now. Um, my mum has had breast cancer. My father has had open heart surgery, and I myself are seeing a specialist for fertility at the moment. So, obviously, I need to get a few tips from Auntie Georgie before I shoot off this afternoon. I didn't study science or biology at school or university, so particularly in the most recent times, I've really had to go on quite a lengthy journey to understand what's going on and to make some really, really important health decisions in my life. My specialist fondly calls me Dr. Bailey because I turn up to every appointment and I've done all my research and I'm super, super curious because I'm trying to be informed. I actually think I probably need my own Google server to power my curiosity because I really am trying to get that information. But I'm not alone, and this presentation isn't a focus group of one of me. Google really is the world's largest focus group.
For the people out there wondering what this is all about, whether it's about courage or controversy, well, I'll tell you what it's all about. It's about what happens from here.
Thank you and good night.
Live, fight like hell.
It's not just about one person. It's about thousands of people. It's about all of us. Accepting one another.
This morning, the Supreme Court recognized that the Constitution guarantees marriage equality.
We're all different. That's not a bad thing. That's a good thing. And while it may not be easy to get past the things you don't always understand, it is absolutely possible if we only do it together.
So today I'll take you through some micro moments that relate to health, a typical health decision journey, and then I'll share with you a behaviour change model using digital measurement to really keep you on your toes. But before we dive into micro moments, let's back up a little bit. Most of us here were probably in that scene 10, 20 years ago. To reach consumers at this time, it was really easy to own the living room, to communicate your message. And then I remember, fast forward to today, when we first started talking to clients, this is the year of the mobile. People in the audience would politely nod and think, no, that's not happening now. But it is. It's your job to understand that consumer behaviour is changing and you need to make decisions accordingly. Today, it's much harder to get your message out there and to own the living room. Media has fragmented and the average Australian household has multiple screens and we're using them at the same time. Think about your own behaviour and your own household. And at Google, we think this is a really, really exciting time. We have this saying called human first, which basically means we put our customers at the heart of everything we do. Our engineering teams are obsessed with how people are using our products and how digital can enhance people's lives. We're also thinking about new ways of taking the technology out of the way, but still leveraging the power of digital. And what's great about Human First is that it enables you to get away from the media fragmentation and to not think so much about the screens, but to actually think about your audience and the moments that they're having.
Does it work? Now, people ask us all the time, how do I get into working? Group, I'd ask you to call out how many times you think people look at their phone every single day. It's 150 times per day, and I'm quite convinced the guy on the plane next to me yesterday checked his phone 150 times in the distance between Sydney and Melbourne. He was obsessed, and there was no Wi-Fi on the plane. I don't know what he was doing. I think it was just a nervous affliction. And these moments are everyday things. They're like sending a text, checking the time, looking at the weather. But many of these moments are moments of intent, which you obviously saw in the video just now. When we're trying to do something, we need an answer to a question, we need to meet a need. And as we've talked about, there's been an explosion of mobile. We've seen a 34% increase in share of mobile sessions. That's more people using their mobile to access the internet. And with using their mobile phone, we've seen a decrease in the time that they're spending on those sites. But they're also willing to act. We've obviously seen significant increase in conversions on mobile phones. And on mobile, people are demanding. Think about your own user behaviour. We're demanding to be entertained, to be informed, and to be delighted. Site speed and user experience are must-haves, and I'll take you through some analysis on this a little later with some site speed tools that we have to test your own site. So going back to Victoria, increasingly Victorians are going online to explore some of their most private thoughts and questions about their health. A recent study by Bupa showed that nearly 80% of Australians had gone online to access health information. But why? Why are they going online, and what are they looking for, and how are they accessing it? So to prepare for the presentation today, I used what's called a Google Consumer Survey, which is essentially an online research platform that enables you to survey a representative sample of a target population across the web and on mobile devices. So we asked 1,000 Victorians who admitted to going online to access health information what they were looking for, why they were going online, and how they accessed the information. And this is what they told us. So 45% said that they were researching a specific medical problem or condition. And joint second was how to lose and control their weight, as well as to research a specific treatment or procedure at 33%. And why? So why were they going online? Why were they turning to the internet? The number one reason was to prepare for a doctor's visit. Just like me, I'm trying to be informed. I want to go to that half an hour appointment with the information that I need. They're also using the internet
because it's a private place to explore your innermost thoughts and questions regarding health. People tell Google things they'd never tell anyone else, not their most trusted partner, friend, colleague, anything. So if you think about your own behaviour and the things that you search for, and you'll get a more personal experience here. Yes, people turn to the internet for everything. So if you're researching a holiday to Europe and you want to book a flight, you're not just going to go online and book the first flight you see. You're going to do the research. You're going to be informed. But for health, this is even more important. The intent behind that search, the urgency. Imagine you're a mother at home with a baby with a terrible fever and it's 10 p.m. at night and you're going online and you need to find that information. That intent is so important. So how are they accessing the internet? Well, 65% said they started with a search engine, and also there is a percentage of people that go straight to the health professional site. And let's think about some big numbers. So 600 million searches or questions relating to health for Victorians in 2015. Now, I've done the maths for you, and that equates to 70,000 searches per hour in 2015 relating to health. And that's growing at 13%. 43% of these searches came from mobile, which is growing at 33%. And I know I'm throwing a lot of numbers at you, and I can see a lot of people writing things down, and I can share this information with you later if you didn't catch it. And YouTube. Many people don't understand that Google owns YouTube, and YouTube is also the world's second largest search engine. And in 2015, there were more than 161 million searches for health. Okay, so I've got your appetite going, I'm sure. You're curious, what are they searching for? So the most searched health category in 2015 was to do with pain management, with 38 million searches relating to things like managing chronic back pain. Cancer and cancer treatment searches were in the top three, with 21 million searches. Now, mid last year, my 37-year-old best friend who lived in New York was diagnosed with stage 3 breast cancer. Now, because she was in New York and was having to move home to Sydney, I spent hours and hours trying to navigate what her treatment options were and thinking about what she had to do with Medicare. So I really, really understand this search journey only too well. And one of the fastest growing categories of searches in health was to do with gender reassignment. We were lucky enough to have Kate McGregor come into Google last week to share her story with us. And the way that she talked through the power of online sources and information at all stages of her journey was absolutely phenomenal. And the way that she described the support that it gave her, really, really rung true when I think about particularly this, top rising search query and the information that needs to be accessible to people. So I've talked about how mobile has increased with 43% of health-related searches coming from mobile, which is growing at 33%. An example here for diabetes searches on mobile grew at 42% last year. And Australians are also turning to YouTube to manage their health. And as I mentioned, YouTube is the second largest search engine. Whether this is for inspirational content like losing weight, or whether it's to be inspired, or if it's someone looking to connect with someone that's going through the same journey as them, YouTube is increasingly becoming the platform that people are turning to. Now, the internet really is the largest audience panel in Australia. The data is phenomenal. Most people that meet anyone from Google think that we're just sitting around all day searching for stuff, looking at data. The data really is at your fingertips. This is a screenshot from a free Google tool we have called Google Trends. And to find it, all you need to do is type in Google Trends into Google and it'll be the first result that comes up, I hope. But what I wanted to show here is that people are turning to Google all day, every day to research and to ask questions specifically relating to health. So the point I want to make is that it's not just during October when it's Breast Cancer Awareness Month that people are having a breast cancer moment. And it's not just in January when people want to lose weight, new year, new start sort of thing. And pain management and back pain is 100% not seasonal. So as you can see here by the trend graph, people are having health moments all day, every day, 365 days of the year, 24/7. And they're going to Google to seek help, to be informed, to be inspired. So the question I ask you is that, are you connecting with Victorians at that moment that matters to them? Okay, let's shift gears a little bit and let's move from the search data, which I hope has whetted your curiosity and given you a little bit of an appetite of what's going on. And let's think about the consumer journey. So just like any consumer journey or any traditional marketing sort of path to purchase experience, the same is true for health. So from the initial curiosity about getting healthier or managing a condition to that conscious decision where you know that you need to make change, people are going to the internet during this journey. It's where preferences are being formed and partners being selected. So you have the opportunity to connect with them during that journey and the ability to then build a relationship and then ideally nudge them later on when perhaps they need it. So for the government sector, which I know I'm speaking to the converted here, capturing them at the early stages of that journey and of that moment is more important, because what you're doing is you're hopefully reducing the reliance on the government-funded health system, particularly when it comes to things like giving up smoking, obesity, losing weight. That's the aim of the game here, is to make sure that you catch them early in their cycle. So I've used a typical consumer journey model that relates to health, and I've used a 2014 study by Microsoft for the basis of this discussion. So it's a similar path to purchase, which we'll see here. So it goes through 5 decision-making stages as people move through when they're trying to achieve a health-related goal. Something like, losing weight, managing stress, whatever it might be. But for health, it's quite unique versus commercial clients. The health journey is often goal-oriented. It's not just about buying a pair of shoes and bam, I'm done. It's a lifelong journey most often. And also, secondly, each person has different measures of success. My measure might be, I want to lose 5 kilograms before my wedding. Or it might be, I really need to think about reducing my risk of heart disease given my father's condition. So just to bring it to life a bit with a personal, not that my journey is anything but typical, because I don't think I'm anything but typical, but I'll share with you anyway. So open to possibilities. This is the pre-awareness stage. This was me late last year, working long hours, doing lots of travel, gearing up for the party season. And then decision to change. I got a kidney infection. So after 3 days of suffering at home, shivering in bed, chronic fever, complaining to my husband, 2 courses of antibiotics that weren't working, he decides to intervene and takes me to emergency. So there I'm lying in the bed and I'm Googling the antibiotics because my headache is so severe and I'm convinced I'm on the wrong drug or that there's a side effect and it's all about me. But I get through it and I realize that a really bad headache is one of the symptoms of a really bad kidney infection. I just need to write it out. But given my fertility journey that I talked about earlier, I take this really, really seriously. So once I'm out of hospital, I start researching everything about the kidney. And I understand that achieving optimal health, and particularly for the kidney, is really, really important. So I decide to undertake a kidney and a liver cleanse. I wait till after Christmas and New Year to do this, by the way. Give myself a little bit of, a bit of leeway. I wanted to make sure I gave it my all as opposed to, really stressing myself out. And I start, and taking control really feels good. The action feels great. I'm feeling better. I'm exercising more. I'm going back to my meditation, and I feel like I'm in control. And then I move into the experiencing stage. I'm really committed to this optimal health. I know how important it is to me, but I need inspiration. I need to keep motivated. So I find lots of great recipe ideas, and I'm following lots of people with sugar-free recipes, and I'm bragging about them. I'm sharing them all on social media, and I'm being that annoying person that uploads all of their meals on Instagram and Facebook. But then what I realize is that I get all these texts and things, people around me, my friends are being inspired, and I'm gravitating to like-minded people, my friends and my family and my colleagues. And I realize that this sort of feeling of community around me is actually spurring me to keep the momentum. I inspired quite a few of my family members and even my husband to do Feb Fast. So we're all feeling pretty good at the moment. But enough about me. Consumers need a unique set of have a unique set of needs at each stage of the health and wellness journey. So let's look at a few of these that relate to these health moments. So at Open to Possibilities, we need personal information. We need a bit of inspiration, and we need to build up that confidence to really embark on this journey and go to the next stage. So there's an opportunity to reassure and inspire people, to take them through that reactive feeling into managing it and being proactive with this stage of their journey. So personal stories from other people or from health professionals, and content like video enables you to have a more one-on-one message with unique audiences that are going through different things. And thinking about search, we've talked about how it's often the gateway to find information. Imagine someone running for the train and they realize when they get on the train that they're entirely breathless. You know, things have changed since the last time they went to the gym or whatever, and they need to think about what that means in terms of their lifestyle. So the biggest opportunities for the health category is to become the partner during these early stages of someone's health journey. As I mentioned, earning the right to later on to nudge and to make sure that you're capturing them in perhaps some of the difficult times. So moving to decisions to change. I think some of these will be familiar to a lot of us here when you just know that you need to change. This journey often starts with search, and digital enables a smoother and faster connection to health professionals, someone that can provide the strongest reassurance for consumers. But this frictionless support is really important to be the partner of choice. There is so much capability out there that you can leverage with technology. Something as simple as a click to call activated ad, if you have a hotline number or if you offer the service of connecting with people on the phone. This is a really, really great way. Someone here is searching for cancer treatment in Sydney. Enable them to connect at that moment that matters to them. So moving into the evaluating stage, this is when it can be really daunting. You're looking at the slew of options that are out there. People are quite overwhelmed with what they find. So making sure that you're creating that seamless experience for them to connect with you. Now, I want to share, so in order to do the Micro Moments, launch Micro Moments in Australia, we conducted a significant amount of research among a variety of Australians, and we asked them to capture themselves in a moment, whether it's in a store and they're looking for a product, whether they're using their mobile phone or their desktop, and to record that moment and share it. So I'll play the video with Kira here.
Hey, it's Kira Smith, and I just got back from the doctor's. So this morning my throat was really sore, and I thought I might as well just go to the doctor's because then I'll know for sure. So I thought I could do it online actually. So I got my phone, I googled FMP Wollongong, that's where I go. And yeah, they actually had a little app that you can use and just book online. It's super easy. I just put in my details and who I wanted to see and what time was available. And that was it. I was sorted. Went to the doctor's and it was, yeah, really simple. I'll definitely use that again. And now I'm on my medication and hopefully I'll be feeling better soon.
So quite a colourful rendition of what the experience she went through. But the point here is that that was a really great experience for Kira. But if we all know our own experience, people are demanding this now. So if you have the opportunity to invest in technology and really, really enable people to connect with you, this expectation of a seamless user experience is really, really important. So at the action phase, people, like I told you earlier, people need help sticking to their plan. You can play the role of the coach by creating video content that's tailored to people during their health journey. Now, this is a really good example from one of our clients, the Defence Force, where they basically go through a coaching series of getting people ready to take the fitness test when they're applying for a role in the Defence Force. So it's snackable, it's episodic, it's bite-sized, and it's really inspirational. So it's helping people get to that level of comfort, knowing that they have to get to a level of fitness in order to go through to the Defence Force. The technology is here now. And we'll hear a little bit more about this from Deloitte Digital later on. But so, for example, there's a really great section on the Better Health channel where you can look at these healthy living apps. So if I really urge you to think about the power of the technology and the power of digital to enable you to think about new ways and seamless ways of connecting with your audience. So the experiencing stage, I shared with you my personal story earlier. This is really about community and sort of context. So I think what's really, really important is to be relevant in local communities, whether it's a running club or here searching for meditation in Melbourne. I think it's really, really important here to leverage the power that content and community and social allows you to bolster the impact that you have, to amplify your message. Now, just because I'm from Google, it doesn't mean that I don't use Facebook, Instagram, Twitter. People live in a digital ecosystem. It's not channel agnostic. So think about ways to make sure that your content is distributed and accessible across all social channels, and they're working at a really powerful ecosystem. So for example, here, the Mayo Clinic have got a really, really great way of using content, but also making sure that the whole ecosystem is working together. So I've gone through a lot of information, and I hope that some of the messages have resonated with you. At each of these stages, there's lots of recommended strategies and pieces of content to engage with and what to think about. Now, I don't know all of you in the room and what's most relevant, but hopefully some of this is useful for you and will enable you to think a little bit differently about the pieces of content that you're planning for, whether it's now or whether it's in 12 months' time. So at Google, we love a bit of measurement and we love a bit of data. So this is, quite interesting and exciting for us. The consumer journey is fractured and we're moving across lots of different channels and devices and screens. So that means all of us being comfortable with new ways of measurement and thinking about constantly testing and iterating where you're getting the data from, who's using it, and what role it's playing in your internal decision making. Our Vice President of Marketing, Lorraine Tuchel, said recently, the beauty of marketing today is that we can really show return. Impact matters, the results matter, and tracking matters. So if there's a message that I leave you with today, it's who in your organization is measuring, and are you talking to them? Are you listening to them? And what are you doing with the data? This whole new world of opportunity digital has enabled a whole new world of opportunity with measurement. So we've got behavioral economists at Google, and I was lucky enough to meet some of them recently in San Francisco. When I was challenging them with the sort of how do we use digital touch points to measure behavior change? Now, I was chatting with Sean about this earlier. This is a whole new world because I understand where a lot of the research comes from, particularly with health, is that unless there's a data point proven, at 2 years' time that someone has, there hasn't been a result of someone dying from obesity, that's the end data point. But along the way, there are so many amazing touch points that you can basically harness to help you inform whether your communications are actually having an impact on traditional metrics like recall, awareness, sociability, salience, and behavior. Now, obviously, I'm representing Google, and there are lots of different free tools and studies that we can offer for communications on our platform. But this exists across, most other digital channels and online providers. So this is something that, we obviously work with your advertising agencies and clients, and this is new and it's interesting. So, there'll be more about this, I'm sure, in 2016. But the message is really you need to start thinking about this and thinking about these different touch points. For example, something as simple as if there's an awareness campaign around quitting smoking, and if someone goes to Google and searches for quitting smoking, that is a really strong indication of behavior change. Someone is willing to make a change in their behavior. So to finish up, I've taken you on quite the journey. So I ask you to think about, are you identifying your moments? It's more about just identifying with your audience, but really put yourself in their shoes. Think about just using your mobile phone for the day and thinking about what would you be searching for? What content do you need if you were your audience? Once you've done this, it's your job to deliver the right content. Think about the user experience. Think about the relevant messages in the relevant moments. And finally, you need to take the steps to measure. So I won't go through these, but these is a little checklist for you to go away and to talk to your teams about. And I've seen lots of people writing down lots of notes during the presentation. I'll share the stats and the data with Carissa. We've also got some really powerful user experience tools, which are free tools, which I'll share with Carissa as well, which can do things like analyze your mobile site against the top 25 principles of mobile UX design. And another one that we've launched recently, which is around page speed analysis. So as I talked about on mobile, consumers have zero tolerance for things like page speed load. So they'll just turn immediately to the next option. So this tool allows you to test your mobile site design and gives you really, really helpful things like reducing file size or think about how the headings are structured. So thank you so much for your attention and for allowing me to share my personal stories with you.